Hello, my name is Ashley Penney, and today I'm going to be talking to you about finding the right ABA provider for you and your child. So what we're going to go over, we're going to start by doing an introduction to applied behavior analysis, talking about what it is and what you might see and expect from applied behavior analysis or ABA therapy. Then we'll talk about steps to getting ABA services in Washington State. We'll talk about some questions and considerations as you meet providers for evaluating who might be a good or better fit for you, your family, and your child. Applied behavior analysis, or ABA, is the scientific approach to understanding behavior and how it is affected by the environment. So what this means is that each and every one of us, our behavior is affected by the environment. Certain things that happen before and after anything we do have an impact on whether or not we'll do that thing again in the future. And that's basically at kind of the core, to boil it down, one of the main components of applied behavior analysis. In ABA, we use behavior analytic methods and the findings from research and what we know about what has been effective for folks in the past, providers in the past, to change socially important behaviors in meaningful ways. And this is a really important component of effective, but also appropriate applied behavior analysis. And the idea here is that the goal really is to improve the life of the person with autism that ABA is designed to serve. So our goal should be to increase access to services, increase access to meaningful inclusion. That's the socially important component of applied behavior analysis, and a really important component. There's a lot of consumer confusion about what ABA is or isn't. And there's a lot of difference in the application of applied behavior analysis. So that's one of the reasons why we're offering this talk to you, is to think about what the application should be, to get a really good understanding of what applied behavior analysis is, so that as you're looking at different providers and trying to find a good fit, you have a little bit more knowledge as a consumer to evaluate what might work for you and your family. How ABA works. So basically, the goal of applied behavior analysis is to take a skill. So let's say the skill that we're working on is taking off shoes and coat upon entering the house, and breaking that down into manageable steps. And so for one person, there may be just one step that is for another person, there may be several steps that we actually have to target. And so we may take this more complex skill and break that down into a couple different steps and then teach those in a really supportive way. With the goal being that then that person can walk into their house, take their shoes and coat off, put them away where they're supposed to be, and avoid maybe the frustration that's caused by not doing those things, but also increase access to a pleasing home environment where things are not, tripping you as you walk into your house. Another component is multiple practice opportunities. So we all learn things by practicing them many times. But what we know is that in order for many individuals with autism to learn some of these new skills, especially if they're skills or behaviors that are not already present, is that we will need lots of practice opportunities. So we don't want to just practice something once a day and expect that that's going to be enough. So we're going to take a skill, break it down into manageable steps, but then also arrange many, many practice opportunities that are meaningful and relevant for the task. We use positive reinforcement. And so positive reinforcement is the presentation of something that increases the likelihood that that behavior will occur again in the future. So something happens, I take my coat off, I take my shoes off, I put them away where they're supposed to be, and I get something that makes me want to do that again in the future. So that's always going to be individualized for whoever the person is, the child or individual with autism, and we'll talk a little bit more about that. But it should always result in an increase in that behavior. We have individualized goals. So each and every goal really should be individualized for the person. So if there is a goal, maybe my goal about taking shoes and coat off upon entering the house doesn't make sense for that family. And that's where you really, as the consumer, as the parent who's meeting with providers, get to ask some questions. So how do parents come up with, or how do providers come up with goals? If a provider tells you, we really need to work on putting coat and shoes away, and that's not something that you do in your family or as part of your family environment, then really I'd be hoping for that provider to be pretty flexible in responding to your request to maybe not work on that goal, but work on something else that's a little bit more individualized for your child and your family. There should be daily data collection, or data collected at least every time that someone is working with your child. Data should be collected on each and every skill, each and every goal that's being addressed. And then we use the data to determine progress and to make changes in the program. And so the data are collected, and then they should be graphed in a way that helps the BCBA, which we'll talk about in a minute, but the supervisor of the program, visually assess progress and make decisions about what do we do next in therapy, which is exactly what leads me to my next bullet of continuous evaluation. So the data that are being collected are being used to make decisions about progress, about continuation of goals, about arranging practice opportunities in different ways. It's all linked, and it's all supposed to be meaningful and functional and individualized for that person. And really, we should be working on real life skills. So, there are many places where goals may be worked on in a clinical setting. And in that case, the idea and the focus really should be on the practicality and generalization into real world settings, but also the skills being addressed shouldn't be things that are determined only because they're easy for someone to work on. They really should be things that are real life skills that the individual with autism will benefit from as a result of knowing how to do these things. So why ABA? Applied behavior analysis maximizes learning potential. So it really uses the science of behavior. And as I mentioned a couple slides ago, what we know about how the environment influences behavior, and it brings those things together in such a way that increases access to learning and access to understanding, because we're arranging the environment to promote learning. It's one of the only evidence-based treatments for autism. And it's endorsed by the American Academy of Pediatrics and the United States Surgeon General. There's also a really great, pretty recently updated project that talked about evidence-based practices for autism, and it's called the National Standards Project out of the National Autism Center. And I would encourage you to look for that if you're interested in a couple more resources. Basically, what that project did was they took a look at different practices, and many of those practices, not all of them, but many of them are based on applied behavior analysis or are components of the science of ABA, and they are evidence-based practices included in that specific standards project. So as I kind of alluded to when talking about different practices within and under the science of ABA, this leads us into thinking about ABA as an umbrella. So if we think about ABA, or applied behavior analysis, is the science of behavior, the individual practices or approaches that are used are under the umbrella of ABA. And this also kind of refers back to some of the consumer confusion that's out there. There is quite a bit of consumer confusion that believes that applied behavior analysis is a very strict, always a very strict, very structured, almost punitive approach. And there certainly were some early applications that looked that way. And there may continue to be those today, but predominantly under the umbrella of ABA, there are a variety of different approaches and applications. And so especially as you look at what may work for your child and your family, it's a good time to educate yourself about what those different approaches might look like. You may hear terms like natural environment training or NET. You may hear somebody talk about, we have a lot of alphabet soup, so you may hear somebody talk about an NDBI approach, which is a naturalistic developmental behavioral intervention. Many of the approaches on this slide are also typically referred to using just the letters, but we have discrete trial training, which is a more structured approach, tends to be really helpful and successful for students who really benefit from having structure and adult-led instruction. We have reciprocal imitation training, also referred to as RIT. This is a play-based naturalistic developmental behavioral intervention that is meant to target imitation, but also shows some really nice gains in play skills, expressive language, and joint attention, which is an early social interaction skill. There's the Early Start Denver model, also referred to as the ESDM. This is a comprehensive approach, meaning that it targets development and skill development across all developmental domains. That's another NDBI. Incidental teaching, this involves following the lead of the child and using reinforcement that is naturally linked to the activities. And pivotal response teaching, or sometimes referred to as PRT, oftentimes referred to as PRT. And this approach involves targeting what are considered pivotal skills. So if a pivotal skill is taught, then that opens doors for that individual. So if somebody learns how to respond to multiple cues, so if you say, sit down, or on the chair, or sit, that I will understand that all of those different things that you just said mean if I engage in this specific behavior, I'm following that direction. So there are a variety of different approaches under the umbrella of ABA. These are some of those approaches, but again, as you kind of start to learn more about ABA, you'll start to A, hear lots of acronyms and lots of letters, but B, get a feel for which approach may be good for you or your child. So there are four main outcomes of ABA, and they're linked to each other. So the number one main outcome is that we want to teach new skills. We all got into, those of us who are working in this profession, we got into this profession because we want to help. And so we want to teach meaningful new skills for individuals with autism. Oops, I went the wrong direction. We also want to promote generalization of those skills. So it's great if you can learn how to tie your shoe in one therapy room, but that's not actually as great as it would be if you learn how to tie all the shoes that you might come across in many, many different settings. And you can tie them on your right foot as well as your left foot, as well as another person's foot, so that you can be helpful if given the opportunity. And these last two are linked together pretty tightly. We want to increase adaptive skills to help individuals meet their needs while reducing challenging behaviors. So those of us in applied behavior analysis, many of us believe that challenging behavior is communication. And it's really important to understand that if someone is engaging in challenging behavior, they have a need that they're trying to meet. And our goal in ABA should be to increase a new skill to get that need met. So we should be working on reducing challenging behavior, particularly those that are causing harm or injury to the individual with autism or others. But when we're doing that, we should also be increasing adaptive skills. So teaching new skills to help that person have a more adaptive way to get their needs met. So what does ABA look like? Who are the players? Each ABA team could have a mix of different providers, but for the most part, these are some of the folks that you'll see. You'll see a board certified behavior analyst. So this person is often referred to as a BCBA or your BCBA. Sometimes people refer to BCBAs as program managers. That terminology isn't used as commonly anymore as it used to be. But Basically, this is a master's level clinician who has a master's degree, most likely in education, applied behavior analysis or behavioral sciences, or psychology. Several years ago, there were a few other master's degrees, so it's possible that somebody could have a master's degree in a different field. But for the most part, this is a person who has a master's degree, has taken specific master's level curriculum on board certified behavior analyst task list, so specifically related to task list items specifically related to applied behavior analysis, and has completed a supervised practicum and has passed a board certification examination. So that's who your BCBA is. We also have board certified assistant behavior analysts. These are less common, but if you encounter one, this is a bachelor's level behavior analyst. So this is someone who has taken specific coursework, has a bachelor's degree, and has also had supervision and passed an examination. Most likely you will have behavior technicians on your team. Over the years, this has had many different names. These have been called therapy assistants, tutors, teachers, a variety of different names, or paraprofessional behavior analysts. Most of the time people are using the term behavior technician. And one of the reasons for that is that there are different state regulations as well as board certification. The Behavior Analyst Certification Board also has a specific registration for behavior technicians. And so a behavior technician is somebody who, there are varying experience levels of behavior technicians. The minimum experience level is a high school degree and some training. And again, there are regulations that vary based on whether it's a behavior analyst certification board behavior technician called a registered behavior technician, or here in Washington State, we have certified behavior technicians. I'm going to talk about the certified behavior technician, or CBT, because that is what many of you watching this are going to be interested in. But CBTs, certified behavior technicians, have to have at least a high school diploma. They have to have completed a training program. And the Department of Health has outlined very clear standards for what is included in that training program, and it has to be at least 40 hours. It has to be supervised by a BCBA, and then a BCBA has to sign off on completion of that training program. And then the behavior technician submits a packet to the Department of Health and actually gets a certification, a CBT, in providing applied behavior analysis services. And so there are minimum training requirements in order to be providing behavior technician services within Washington State. There's also, for the board certified behavior analyst and board certified assistant behavior analyst, the BCBA and BCABA, there are state level licenses for those positions as well. And another really, really important person, someone who you will probably talk to a lot, may also have very many different names. This is a patient navigator, or sometimes called a scheduler. This is someone who will be working with your insurance company to make sure that you have approval for applied behavior analysis services. They will be talking with you about scheduling sessions. And this may be something that two different people do within an organization. Every organization does this a little bit differently. In general, these are the players. These are the people who you're going to be seeing a lot of. The person who you will most likely see the most of is the behavior technician. As the paraprofessional, this person is the one who spends the most time working directly with the individual with autism or with your child. And then the board certified behavior analyst actually provides supervision for that program. So the first person you'll meet will be the BCBA, most likely. And that person will conduct an assessment of your child's skills, should be talking to you about goal areas and your experience with your child's skill level, and then we'll develop a treatment plan from there. So then what does that treatment plan look like? And then what happens after that treatment plan is developed? So there are several different treatment approaches, and this is always going to be and should be individualized for your child and determined by that assessment that the BCBA is conducting in order to decide what the best approach for maximizing outcomes will be for your child. So often we do many one-on-one programs. So this could be one-on-one in the home. It may be one-on-one in the clinic. And this is one-on-one intervention or treatment or therapy provided by the behavior technician that we talked about on the last slide and supervised by the BCBA. Many treatment approaches include parent coaching, or some call it parent training. Parent coaching and parent training are actually two different things. So parent training involves more didactic learning. I'm the teacher, you're the learner, instruction for parents. Parent coaching actually should involve the child too. So that would be something that the BCBA would be supporting the parent in some type of daily routine with their child. We also see group programs. So group programs typically have a curriculum that they're following, and then the individualized approach happens within that curriculum. So the goals are individualized for the child, the support is individualized for the child within a group program. We see dyad sessions. A dyad session would involve two children or two individuals who are both working on similar goals, and we've identified that they could be working on those things together in a really meaningful way. And then we also see community intervention, and this can look different depending on the community of the client or the child or person if it's an older individual with autism. What do the hours look like? The number of hours for each person's ABA program will be different. And this, again, is because it should be individualized based on the person, based on the assessment, and based on availability too, to some extent. It should be it's not a requirement, but it is something that clinicians can and should spend a lot of time thinking about and really making meaningful recommendations for. So some factors to consider when thinking about all these hours, because it's a lot of time. Factors to consider would be the time that your child or you or whoever it is spending in school. Other therapies, those are also things that take up a lot of time and are targeted interventions and support. Location of services, sometimes families don't have access to services nearby and spend more time traveling to a session than they spend in the session itself, and then they have to go back home after. It's important to think about tolerance and developmental level. Sometimes it can be nice to ramp up hours. So talking with providers about the possibility of that, what that might look like is more hours on a treatment plan than you initially start with, and kind of ramping up as your child shows readiness to do that. It's also important to think about the family balance. This is a huge undertaking. It's a really important thing to be doing, of course, but it is another thing to be doing, and it's going to be a lot in many ways. I mostly hear from families saying that it's worth it, but just I think it's helpful to know going in that it's a lot to be starting. And then it's important to think about the age of the child and competing needs. And really it is important to be thinking about things like nap time and sleep times, thinking about your family's schedule and how that's going to line up with the therapy slots that you've been given. Those are all really important considerations. What does it look like? So again, we kind of talked about some of the format, but the location is pretty similar. Most of the time, ABA therapy is happening in the home or in a clinic. Rarely and decreasingly, I would say, it's happening in schools. And most of that is because as ABA increasingly is considered medically necessary, most insurance companies are viewing school time as an educational need, and this is a medical need. And so that those less and less often is ABA being provided in schools by BCBAs, unless that's a BCBA who is working with the school district. That's more often what we might see. but then also importantly in the community, because that's where we all live and reside. And so it's really important to be offering some meaningful practical application of those real life skills in the real life settings where we want to see them happen. A typical ABA session, again, there's really isn't a typical ABA session because it should always be individualized for your child. But in general, we may see something like 2 to 5 sessions per week, and each session may be 2 to 4 hours. 4 hours is a long time. So it's important, again, to be thinking about some of these other factors that we just talked about. And in particular, when thinking about some of the longer sessions, there are some agencies who have session minimums. And that's an important question to ask if you have a really young child, in particular, a young child who needs to nap and might not be awake for really long periods of time. So what does ABA look like in terms of parent involvement? In home-based services, there should be opportunities to observe during the session. This may be something that, providers may want to spend some time establishing rapport and what we call instructional control. So building up the idea that if we say, let's go play this game, that the child is going to come along with us and play that game. Sometimes providers may ask that parents not spend time observing sessions early on in order to develop those things, but I think it should be a conversation about when will that be something that I can start doing again, because it's important for parents to be involved to know how things are being worked on so that you can carry over those things through all your daily routines and activities. Also in home-based services, we think about participation in those activities. So really it would be ideal to have parents be involved in some of the activities, especially those that maybe the child has been working on with a therapist and is able to really think about moving to that next step of generalizing with parents and other people. And certainly within parent coaching. So working directly with the BCBA and the child present to practice some of the skills that the child's been working on, or things that are maybe more specific to parent interactions with the child than some of the other more general therapy goals. In clinic-based services, oftentimes clinic-based services are a drop-off, but it is worth asking, and you should be able to observe clinic-based services. It's your child and what he or she or they are doing, so it would be important to be able to know what that is. And then again, parent coaching should also be happening in a clinic-based approach. Again, in school-based services, those are less common, much less common, and that will depend on the school, the provider, and if this is being paid for by insurance, really will depend a lot on the insurance company. Hopefully there's also a parent coaching component to that program, and so that could be something that maybe isn't happening at school but is happening at home, or perhaps it is happening at school. Also, the ABA team in this case would likely need to be included in IEP meetings. That again is another thing to really check with your insurance provider about whether or not that's going to be a covered service. Why is ABA hard to get? So there are not enough providers, and there are really long waiting lists. And in particular for state insurance plans, there are very, very, very long waiting lists. Insurance coverage and benefits, these vary from, whoever your employer might be, but also being in network and contracted providers is specific to different insurance carriers. Providers and the family, sometimes there's a person who's covered and contracted with your insurance and they do not have the same availability that your family does, and maybe you both have really hard no's on or inability to be flexible with that. It's a long-term intervention, so that definitely impacts waiting lists too, because most of the research on effective applied behavior analysis involves 2 or more years of intervention services. And oftentimes, even at the conclusion of those studies, if it were not a research study, that person probably would still be presenting, or many of the folks involved would still be presenting with skill areas needed for improvement. And so it's a long-term intervention, and many people stay in ABA for a really long time. And our service field is constantly changing. So just in 2017, did the Department of Health in Washington State start licensing BCBAs. And so there have been some pretty major changes just in the last couple years. And then similarly, a little bit more time has been spent increasing the number of providers and insurance coverage. So it's kind of an ever-changing field to a certain extent. So what do you do? How do you get ABA? Number one thing is to ask some questions for your insurance provider. So call your insurance provider and ask, do you cover ABA services? And then what are the criteria, if they say yes, what are the criteria for my child to receive ABA services? Sometimes for some insurance carriers, the diagnosis has to come from what is considered a center of excellence, and that is something that is a state distinction. There sometimes needs to be a prescription or an ABA recommendation from a qualified physician or a qualified type of provider. Sometimes the diagnosis or prescription needs to be renewed every so often. And so that's an important thing to be aware of too. There have been some pretty frustrating stories that I've heard from families who didn't know that every 2 years they needed an updated diagnosis or an updated prescription. And they only found out when services occurred, and then their insurance company said, we're not going to reimburse you, or we're not going to pay for these because you don't have an updated diagnosis or prescription. So it's important to get some of that information. And unfortunately, that can change too. So being aware of those changes and maybe checking in regularly with your insurance company to see what might be changing. It's important to ask which ABA providers are in network. It's important to also ask if you have any out-of-pocket expenses for ABA services. So that's step one. It's quite a few questions, but hopefully it can all happen in one phone call. And then once you've got all that information, then you start calling your ABA providers. And I would encourage, because there can be really long waiting lists, I think it's important to cast a wide net. So start calling lots of people and getting on lots of lists. And then as you start to hear back from people, you can start to evaluate whether or not it's going to be a good fit for your family. But first question would be, this is my insurance. Do you take this insurance, or my child's insurance if your child is on a different insurance than you? Do you have a waiting list for my address or my county? You can be pretty specific about this. Or maybe some places are center-based and they might not really, it might not matter where you live. Many places that provide in-home services have boundaries. So it's important to ask about that. How many hours a week should we expect to receive ABA? That might be an important thing to hear from providers if they have session hour minimums or a certain number of sessions per week minimum. Where are services typically provided? What's the location? Is it in-home, clinic, school? What are my copays going to be? And are there other fees for things that my insurance won't be covering? Sometimes places charge for travel of clinicians to and from your house. Do you have paperwork for me to fill out? Do you have an intake packet? Are there forms that I need to be submitting to you? And then what can I do while I'm waiting? Some places, like the University of Washington Autism Center, we offer many workshops. Are there things that you can do while you're waiting? Next step is time to plan. So after you've called and got on the appropriate waiting list, it's a good time to start gathering your materials together. So gather the documents that you might need. The diagnosis could be a big, thick packet. You might also have a prescription letter from the provider that's just one piece of paper. Some of these things, again, would be things that hopefully your insurance provider had told you were really important to have. And if your child has an IEP or an individualized education plan through their school district, or an IFSP, an individualized family service plan from a birth to 3 provider, those would be important documents to include as well. And then take a look at your calendar and your schedule and really decide what are the things that are flexible and what are the things that are not flexible, and make sure that you have a really clear understanding of what that is for you and your family. And then within doing that, determine what your availability for ABA might be. And then get on the waiting list for the providers in your area. As I mentioned, it can take a while, so it's always a good idea to have a plan for checking back with places. Some families find this helpful to organize on a spreadsheet in terms of the documentation required for different organizations or providers, and then their kind of check-in schedule with those providers. So sometimes we encourage families, if they haven't heard from a provider in 6 months, to call and double check with their ABA provider, maybe their insurance company. I think most often insurance company changes happen annually. And then figure out if requirements have changed, ensure that they have your paperwork and that you're on the right list. And then if you have had changes in your availability, let the ABA provider know, because sometimes ABA providers are aware of what you had said with availability, and they think that you're not available, let's say in the morning, and really you maybe had a change. Your kid moved from morning preschool to afternoon preschool, and you were just kind of waiting to hear from someone, so you didn't mention that. It's worth mentioning that if your availability has changed when you call to check in and get an update. And then again, be attending trainings or workshops or learning what you can. Sometimes the internet can be a pretty wild place, so find a trusted source. Find, a Facebook group or some place where you can bounce ideas off of other families, and think about some other ways to access resources in the meantime. We're going to wrap up with a couple questions and considerations. I would suggest that you read this document from our website. We have a neurodiversity ABA handout, and I'm going to click on this so that you can see it. But this was written by a provider at the University of Washington Autism Center. And it's beautiful and really wonderful and a very helpful document. So it's called Finding the Right ABA Treatment. It's 4 pages, so I'm not going to go through it right now because I really do encourage you to find this document and read it for yourself. But if you look up UW Autism Center, I can show you right where to find it. Click on our website and then hover over resources, and you'll see a resource on neurodiversity. Click on that and scroll down, and you will find the 3rd bullet is Finding the Right ABA Treatment, written by Dr. Harrington of the University of Washington Autism Center. So I encourage you first and foremost to check that out. Next, a couple other questions to think about would be, what are some of the things that you heard from the providers that you talked to on the phone? Or were you never able to get someone on the phone? That shouldn't be a complete no-go. I would encourage you to keep trying and try and reach out to people, but sometimes, especially during very busy times, it can take a while to get through to somebody. But consider some of the questions that in particular Dr. Harrington presents on the neurodiversity handout, and think about what they mean for your child and your family. What are your child and family values? What do you want for your child in terms of self-advocacy, self-acceptance? So I think there's a lot of really great considerations in that piece, in that handout. A couple of other questions to ask providers, and many of these are geared toward very young children, but they don't necessarily have to be for very young children. I think it's important to get a sense of how many individuals who are the same age as your child that provider has worked with. This one I do think is pretty, I think across the board is really an important one. If you have an adolescent and the provider really has only worked with itty bitty littles or preschool age, it's going to be important for you to understand how that person is planning to provide appropriate, age appropriate or developmentally appropriate or content that is relevant and meaningful for your child and applicable in their settings. For young children, thinking about accommodations for nap schedules, what happens if providers are only available during my child's regular nap time? I think it's important to ask if parents can be involved in therapy sessions. Can you observe some of the questions that we talked about on a couple slides ago? If your child does have challenging behaviors, I think it's important to ask whether or not you'll learn about how to respond to those, and if that can also, how the provider will take into account your parenting style too. For bilingual families, have you worked with bilingual families before? And what is your approach to working with bilingual families? We have another resource on our Autism Center website that I encourage you to check out. This was developed by some of our speech language pathologists, all about bilingualism and autism spectrum disorder. So I do encourage you to take a look at that as well. You can also find that under resources. And just do this again. And finally, I just want to take an opportunity to thank you for attending this video, watching this video. And if you have any questions, you can contact me. Feel free to contact the Director of Training and School Services, Robin Talley, or contact us in general at the University of Washington Autism Center. Stay tuned and check out our website for other offerings, workshops, and trainings that we have. I'd love to see you there sometime.